Hello and welcome to the Best of Tri-State podcast. This is where we interview exceptional individuals in the healthcare and small business space, learn more about them and what makes them unique. I'm Isaac Ervin, and today I'm joined by Dr. Emma Sprague. She is a local Union County native, born and raised here. She went to Union County High School and then went to the University of Kentucky to get her bachelor's degree, and then she went to Palmer School of Chiropractic, located in Davenport, Iowa, and graduated there recently. And now is practicing as a doctor of chiropractic here locally in Union County at Chiropractic and Wellness. Emma, correct me once this is over if that's the appropriate name. I know you're going through some rebranding stuff, which is awesome. Um, but Emma has a very unique specialty and unique interest. Emma, thank you for joining me, and we're super excited to learn more about you and your practice.
Yeah, thank you so much for having me, Isaac. I really appreciate the opportunity, and I'm really excited to be back in this community and be giving back to the community that's helped me so much and in my life up to this point.
Yeah, and we're super excited to have you back here too, Emma. It's great to have young, motivated, professionals come back, go learn a skill, right, and then bring it back to this small, underserved community to bring back some modern medicine and modern conservative medicine, which is what you all provide. So I think it's fantastic, and we're super excited to have you back. The first question I always like to start with is and I'm sure the listeners are curious as well, is what made you decide to become a chiropractor?
Yeah, I love talking about this because has a lot of story has a lot of twists and turns, a lot of nuance to it. But it started in 2003. I started chiropractic care as a 2 year old because of chronic ear infections, gut issues, kind of things that you may not think traditionally about utilizing chiropractic for, but with pediatric chiropractic, it's has a little bit different perspective to it. So that was that was me as a 2 year old, colic as a baby, overall not well, and kind of my mom had gone through the conventional medical route with that, lots of antibiotics, tubes in the ears, tonsils removed, that kind of path, and I just wasn't getting better, wasn't getting results, and so she was kind of looking for something outside of the box, something alternative, and someone invited her to come to a talk here at Cairo in Morganfield, and so that started my journey of chiropractic care. And I grew up with chiropractic care on a regular maintenance type basis, and it definitely impacted how I viewed health, how I viewed wellness, a little bit out of the box thinking, even from a young age, just because of growing up with chiropractic, and then um, as a middle schooler or early high school, I started getting into more of the wellness lifestyle type stuff, healthy lifestyle. Started doing CrossFit. I started eating healthier, learning more about um, things like the products that you put on your skin and how those might be affecting health, and um, how your nutrition impacts your health and how your sleep impacts your health. Just things that are beyond even diet and exercise. And so I kind of started getting into that. And then as during COVID, during that season, I really felt like I needed to go to chiropractic school. Felt like I had something to share and help people with that was outside of the box, that could provide them, an alternative perspective, alternative route when it came to prevention rather than treating symptoms down the road. I felt like I could maybe get to people earlier and help them with issues before they were really in a tough spot, which I'm super happy to be able to help people with now.
That's awesome. So just to make sure I understood you, it was stuff for that, your mom got you in as a young kid, but then you started kind of developing your own interest, not only in chiropractic care, but more conservative treatment to pathology, right? Through exercise, sleep management, stress management, and nutrition. Does that sound right?
Yeah, yeah, definitely.
Cool. Awesome. And it's great. It's that those four pillars of health, right? That I just named are super important. And I think it's something that's missed a lot, right? That by uh through in treatment, right? It's like you said, symptoms are treated, but what's the actual root cause, right? How much is the client sleeping? How are they stressed to the max at home and at work, right? What are they eating? What are they putting in their bodies, and how much are they moving? Right. So, I think that's fantastic and a fantastic approach to conservative healthcare. So fantastic. So now you're at Cairo. Tell me about the rebrand. What is the business like called, and is the rebrand done? Is that something that's more hush hush? Tell me more about that.
No, it's definitely in progress right now. We ran into a little bit of an issue with like officially changing the name of the business and not having chiropractic in the name. So that's kind of where we're at right now. But we're still moving forward with legacy health as kind of the overarching theme between the different services that we offer. We really just felt like chiropractic didn't fully embody all the different things that we do with the functional lab testing and supplements and all of the educational content that we're working on. So we wanted to kind of expand with a name that could expand with us. So that's what Legacy Health is. So we're moving forward with that as kind of an overarching theme, but um, chiropractic is still the name of the chiropractic
Got it.
portion.
So legacy health, but chiropractic. If your listeners are looking for individuals that we'll get into the services here in a second, but if you're looking for the services that we discussed today, chiropractic is what you're going to search, whether that's on Google, Facebook, social media, all social media outlets. So very good to know. I just, for me, myself, I know we've talked about the rebrand, and I was just curious on where that was at. So with that being said, right, the services that you all provide, because you said it yourself, not your traditional kind of chiropractic clinic where it's solely just adjustment services, right? Tell me more about what all you guys are doing down there at Chiro.
Yeah, thank you for asking. So we kind of have a four-legged stool approach that we like to kind of explain our system, but then also it ties into our services as well. So chiropractic care, kind of in the more traditional sense, we absolutely do, and we offer that, and we love serving the local community with that. But then we also provide functional medicine, lab testing opportunities for people and then do consulting based on those labs, which is kind of it's separate from the chiropractic, although they work really nicely together. And then we have our own supplement line, and we have a store that's kind of connected with the office where people can come in and get supplements. And then that's also online. And then we're working a lot on our educational resources. We have about 10 ebooks, and we have a lot of online content that we're working on, and we're always working on growing that. So that's kind of all of our different offerings, and they really come together nicely to help people on their holistic health journey.
Yeah, that's great. Yeah, for you all listening, to have these services here locally in Union County in a rural area is unique, right? These are services that typically you're not even finding in the big cities a whole lot. I know in St. Louis, you didn't hear a lot of individuals providing these types of services. So to have that here locally is very unique, to say the least. So through those services, what are the most common issues or clients that you all encounter in your practice, and how do you all best serve those individuals?
Yeah, that's a great question. I'm as being a newer provider, kind of working through what's my niche going to be, and I love working with moms, with young families, young kids, pregnant women, and just families in general with on the chiropractic side, but then also on the functional medicine, lab testing, optimizing your lifestyle side as well. Um, so what might that look like? Um, if a woman is pregnant and she's dealing with any type of discomfort or challenges related to pregnancy, or just wanting to optimize, her birth outcomes. I think chiropractic care and functional medicine care is a great way to work on that. Fertility challenges, there's a lot that can be done from a functional medicine perspective there. If someone's looking for more holistic things to look into related to that topic, things related to the gut. A lot of people are dealing with GI, gut related challenges. We serve a lot of people who are dealing with that. Some of my colleagues, Dr. Terry Harmon and Dr. Matt Himmerly, they have kind of their own niche. Dr. Matt Himmerly, he works with a lot of kids with ADHD, autism type challenges from a chiropractic side, and from a functional medicine side, he really likes working with them. And then Dr. Harmon, he kind of has a specialty working with people with cancer that are looking for just natural support on their cancer journeys, not necessarily treating cancer by any means, but just being a natural support for people on their journey with that as well. So big variety, and it's kind of a long answer to
Yeah,
your
no, it's great. It's
question.
perfect, right? Because I mean, you went from individuals that are in pregnancy and going into delivery and labor and postpartum, right? All the way to their children, and then children with kind of behavioral diagnoses, and then also on the with Terry, the cancer, I don't want to call it treatment, but you said it very eloquently. Kind of that support, right? And during that healing process. So what a wide variety of services that you all provide. That's great. But we'll focus, since you're here, we'll focus on what you do, right? So you talked about women and moms and women's health. Is that correct? Just
Yeah.
provide clarity there. Yeah, and that's great. So it sounds like if you had a choice, if you could stack nothing for a 40-hour week of one type of client, that would be your client base. Is that correct?
Yeah, if that was possible, I would love to do that, but
Yeah.
definitely not limiting myself to that. But I love working with those populations, and get a lot of have a lot of gratitude when I get to do that. So
Yeah, it's great. Tell me what got you interested in that niche.
yeah, for sure. I have always dealt with kind of challenges with my own cycle, my own menstrual cycle, that kind of got me into reading and learning more about that. A lot of times are I know a lot of providers have their own kind of challenge that leads them into learning and growing and having an appreciation for that. So that was definitely my story from a very young age. Just painful, painful periods, lots of hormone related challenges that really made me dive into that subject and learn from a functional medicine perspective what lab markers and what things might be playing into that, like the health of my gut and toxins and stress and my sleep and nutrition and exercise, and how all of that impacts your menstrual cycle. And for women, I think that, you know, we haven't always been taught it, but you can view your cycle as kind of a check-in or something that is kind of another like biomarker for you. So I think it's really foundational for women to have healthy cycles, and then it plays into their outcomes with pregnancy, and then postpartum, going through a perimenopause season, a menopause season, all of those things. So I think a lot of uh, a lot of different challenges for women can come back to what's going on with their hormones, what's going on with their cycle.
Got it. So personal struggle on your end in regard to your monthly cycle is what got you into this women's health specialty. Is that correct?
Yeah, definitely.
Perfect. Perfect. Yeah. So now you're here, you're treating, right? You've got this niche and this special interest to serve, this tri-state area. Tell me what does the journey look like for someone that maybe is struggling with X, Y, or Z thing that is specific to your niche, right? What does that journey look like? What type of symptoms or when would it be a good time to come see you, right? Number one. And then number two, what does it look like to start that journey with you guys? Like if they are having said issue.
Yeah, I think from the perspective of when's the best time to come see us. I wish I could, kind of talk to every teenage girl and just educate them more about understanding their cycle and how important it is from a young age. But from a chiropractic perspective, I definitely think it's better to come in before you're really in a tough spot. So if you do have that preventative mindset, I think that can be very beneficial. Just looking at what can we optimize, how can we prevent, a possible injury, a possible, more visceral issue is definitely that's the best time to come in. But certainly if you're having a specific challenge, we would, love to serve you and help you with that as well. It's not just from a preventative standpoint. As far as the patient journey, we do an initial intake visit. That's a history, um, medical history consultation. We do a physical exam from more of that chiropractic perspective as well. We do some other testing in our office. We will do spinal X-rays if we think that they are warranted. We do an heart rate variability nervous system assessment that is really cool that assesses is the body in a fight or flight sympathetic state or is it in that rest, digest, heal state? And we can see some of that data from an objective standpoint and kind of pair that with someone's symptoms and challenges and our exam. And then we have an in-body scanner as well. So that's going to look at muscle mass, body fat percentage, kind of give us some objective data on that. And yeah, I think that's kind of the initial visit. So from there, we kind of split our services into functional medicine and chiropractic, and depending on what route people want to go down, we'll do a review, talk about the findings from all of that exam, and then kind of create a game plan, talk with the patient about that game plan and move forward from there.
Perfect. So if they're struggling with the things you said before, if they're preventative minded, right, that'd be great. But they're struggling with pain during pregnancy, issues postpartum, or any other sort of women's health or reproductive system, GI, urinary system issue, right? Not just that, but specific to your niche. That's when they would start, and then all of those things, which is a ton of stuff to get at an initial consult, right? And then based on that information, you all provide or prescribe a plan of care to get them whatever result they're looking for. Is that correct?
Yeah, pair, our findings with the patient's goals and try to create something that's symbiotic for everyone and get them the results that they're wanting.
Perfect. Yeah, I think that's great. And it sounds like you all use a lot of, you guys are very thorough on that initial evaluation to come up and with that plan of care that's specific to that individual's goals. And I like that you brought up their goals, right? Because that's, that goal is the driving force behind everything that we do, especially healthcare and improving quality of life. So it's perfect. I love that. That's a big focus of your all's. Let's see. Um, I know you're a new clinician, right? Haven't had a ton of reps that at this point, right? But typically, whether it's through school, right, or currently in what you're doing, there's some patient or client success stories that stick out or stand out to practitioners. Do you have one of those stories? It's one of those things that I feel like a lot of people love hearing, are patient success stories.
Yeah, for sure. Well, I think from the beginning, I kind of talked about my story a little bit, and that was the big driving force of just how, going from that sick baby to, being able to be a healthy and thriving, young adult. So I always like to share that because our personal story drives a lot of what we do and what our purpose is. But as
Mhm.
far as patients that I've been seeing recently, let me think for a minute. A baby struggling with colic definitely sticks out. That baby in our office, just crying, screaming, very obviously uncomfortable. Baby was struggling, and everyone in the office was aware that he was not doing well, and we all had a lot of sympathy for what he was dealing with.
Sure.
But then they come back next visit after the first adjustment. Mom's like, he slept 6 hours, and is just had such a huge difference from just one chiropractic adjustment, which we always don't see, night and day differences in one adjustment. That's why we do a plan of care that's longer than that. But it was so cool to see, the baby that was really struggling with sleeping, with eating, with colic, and then was able to have such a big difference with one adjustment. And I love working with the babies. They're a lot of fun to work with.
Yeah,
So
that's big because if you've got and I've got my oldest daughter was tough. So like when you're not sleeping and your kid is screaming their head off and they're uncomfortable and then you're stressed, but then you're not sleeping, so it makes you more stressed, and then you're probably not eating that well and don't feel like exercise, and it just those pillars of health just start to crumble. From the parent perspective, like it's a huge to be able to get some relief for your child is such a big deal in that time period because you just are overwhelmed at that point. So
yeah,
it's a
absolutely.
fantastic story. And shows the impact of what you all do and how you all can help individuals in this community, particularly those new moms and dads with a child struggling with colic. Um, What's one thing, you've talked about all your services, right? What's one thing that you wish that everyone listening knew about the services that Chiro, chiropractic and wellness provides?
Hmm. Good question. Let me think on that for a second.
Yeah, no
Uh,
worries. Take your time. Because you all do a lot, right? And from the just not just chiropractic adjustments, the functional medicine side, and then now that you all are hiring these doctors that have their specific niches, right? So much that you all do. So um, I figured there was one thing, right, that about your all's clinic that's special or unique compared to other places that you've either worked or other places that you've had the great opportunity to um, be a student at through chiropractic school.
yeah, I think um, kind of if I could help people understand one gem, I would think I would say that understanding that your nervous system drives so much of health concerns. It's kind of an underlying factor there. So I mentioned that a little bit ago about is your body in a fight or flight state, or is it in that parasympathetic rest digest state? If I could teach people that and help them understand that, I think I would be be really happy. But as far as um, related to our services, I was having a conversation with someone last week, and it stuck with me about just understanding that your lifestyle choices matter. And people can make great lifestyle choices and not necessarily utilize our services for sure. So that kind of applies to everyone, but understanding that the food that you put in your body, whether or not you choose to exercise, your sleep habits, your screen time habits, the way you interact in your relationships, everything, all of those choices that we get to make every day impact our health and impact, chronic disease. They impact the way that we feel and whether or not we're in pain, and just helping people understand that your choices matter and that you can always, work on your health and be empowered based on the choices that we get to make every day.
Amen. I love it. Those small choices we make on a daily basis come compound and become big, have a big impact over time, right? So I can't agree with you more on that sentiment. Uh, for those listening, Emma, what's the best way for them to get into contact with you if they heard what you said and said, "Hey, I'm the perfect candidate to come see Dr. Emma Sprague at Chiropractic"? How do they get a hold of you all? What's the best way for them to do that?
Yeah, so we have a website. You can visit our website, which is chiropractic.com, and chiro is spelled CHIRHO. And our website has lots of good information if you're wanting to read more about what we do. And there's a link there if someone wanted to schedule a new patient evaluation with us. You can also give us a call. 270-389-9696 is phone number, and we'd be happy to chat with you about any questions you have and get you set up that way as well. And if you're just looking for me, I have a page on Instagram that I like to post lots of fun health things to, and kind of stay up to date with things that I share. So you can definitely follow me on there, and hopefully hopefully you enjoy some of the content that I have to share on there.
Perfect. So we'll include the website, Chiropractic socials, as well as Emma's personal social media pages in the link below, as well as a phone number. So those individuals interested, just click on the information below, and you can find and contact either Emma herself or Chiropractic as a business through those links. So, uh, Emma, I don't have any other questions. It sounds like you all are doing awesome things down there, Chiropractic and Wellness. I'm super excited to see how you and your skills develop, right? Being a new grad and helping this very special population with moms and either soon to be or expecting or new, or I'm going to say older, not that they're older having the child, but moms that have older children in general, right? To that's a very special population, and they're very lucky to have you here in Morganfield to serve them. So we appreciate you and we appreciate your time. Thank you so much for joining me today.
Thank you, Isaac. I really appreciate you having me on here, and thanks everybody for listening.